So, before I begin, I would like to say thank you to Professor Carraro for the invitation and for the opportunity to be part of this interesting Congress. And so this is the last day, so I can take the opportunity to say thank you. Today, I'm gonna talk about some of the application in rehabilitation of balneotherapy and health resort medicine that we are currently undergoing in Padua, the University of Padua, thanks to the collaboration with the different spa facilities scattered in the territory of the Euganean thermal heat. So, to talk about rehabilitative application in our days, it is important to think about the history of health resort medicine. And as you know, health resort medicine since the ancient time had always been applied for two different purposes. On the one hand, it was exploited for recreational purposes, for example, during the Roman period. And on the other hand, it was exploited for its medical and clinical potential, as thermal and natural resources were able to be employed to recover health. And these two souls are still present in our years, since now patients are going to the health resort setting both to recover health and to spend their free time, to relax and so on. But we have to address what are the new needs of patients, and in particular, as you know, people are getting older, and so we have to reserve to these people more rehabilitation services since chronic diseases and chronic disabilities are increasing. A recent analysis published on The Lancet has highlighted how 1 in 3 people in the world will need for rehabilitation services during their entire lifespan. And so we have to think about new intervention and new solution for patients requiring rehabilitations, even nearer to patients' home and to patients' needs. So, the answer to this great need for rehabilitation that the University of Padua is trying to give is to convey a part of rehabilitation services in the spa setting. And in particular, we have started to treat patients with musculoskeletal disease and musculoskeletal disabilities in the spa setting of the Euganean thermal hills. And here I reported one of our last studies in which we consider patients with the recent outcomes after hip surgery. And for these patients, a 2-week program exploited in the Euganean thermal hills, which included rehabilitation exercises both for strengthening lower limb, for mobility of the limb, for balance and also for gait training, but also physical therapies such as electrotherapy and low laser therapy, and educational interventions have demonstrated to have positive results in these patients. And I reported here some of the main results. Our patients reported an important increase in hip mobility and in a decrease in hip disability, and an overall improvement in quality of life. These results were also confirmed by a recent study we published in this year with a larger population of patients. We considered 160 patients who performed 2 weeks of aquatic exercise, and to a part of these patients also traditional thermal therapy was applied. And as you can see on the left of the screen, for these patients at the end of the treatment, improvement in pain, anxiety and mood were recorded using the numerical rating scale, and also an overall improvement in quality of life in the physical and in the mental component was recorded. Then we tried also, as you can see on the right of the screen, to compare different type of waters. And if you consider the water that are present here in the Euganean thermal basin, the so-called salso-bromoiodic water, we recorded a positive effects related to the use of this particular water with beneficial effects in mood, anxiety and pain. Obviously, these results needs to be confirmed by other studies with further population. But now we are studying the effects related to the mineral content of water. In particular, these results, these studies are considering the pro-inflammatory pathways and the cartilage degenerative pathways in vitro and in vivo studies. Considering in vivo model, we are now searching for mechanism at the basis of the reduction of the pro-inflammatory cytokines cascades activation in patients treated in the Euganean thermal basin, and for pathways that can be responsible for reduction in cartilage degradation. So to summarize, our approach is based for musculoskeletal patients is based on traditional thermal interventions combined with rehabilitative interventions such as exercise, education, and physical therapies. But do you think that this is enough? It is all we can do is for patients with musculoskeletal disease? My answer and the answer of the University of Padua is no, since we have already started to consider patients with neurological and neurodegenerative disorders. In particular, we have conducted 2 studies on patients with Parkinson's disease at the early stage of the ONDR scale, and for these patients, an intervention in the Euganean thermal setting of 4 or 6 weeks have demonstrated to be useful to improve the freezing of gait, the balance, the quality of life, and the overall motor function. Moreover, this is another important field of our activity. We are now currently evaluating patients with long COVID outcomes, so the outcomes reported after the resolution of the acute infection of COVID-19. And what we are now evaluating is the persistence of chronic fatigue, respiratory outcomes, dyspnea, and mobility impairments in these patients. And for these patients, interventions in the Euganean thermal basin have demonstrated to have some effects. I hope that we have now the preliminary results. I hope that in the next year I will present them all completely, also with the follow-up evaluation. So what are now planning for the future? On the one hand, we think that the remote healthcare services have had a great increase during the pandemic, and so we want to apply this also to our patients in the Euganean thermal basin. And so we plan to monitor from a distance patients through therapists and doctors through remote control in order to understand if we can monitor patients and adjust therapy from a distance. Moreover, we are now recording, collecting data from patients of the Euganean thermal basin in a database, and we plan to expand the application of this database to different centers in all the national territory. So thank you for your attention, and thank you very much.
Could you ask to how many Zoom attendees there are? No one? One. Could ask that one if he is willing to ask something to Maria Chiara? or someone here in the audience,
I made a private talk, so.
because I have a main question. You really believe that this kind of medical hotels may be spread in Abano and Montegrotto, or Hermitage is and the other is the exceptions?
I
and
think
will remain the exception for years and years. How many now?
I think that this medical culture, medical and recreational culture should be spread in other centers. And I think that now in our territory, so in the Euganean thermal basin, the spa facilities with this mental approach are increasing. So I think that this is not more an approach isolated, but is something that is progressively increasing. And we hope also that with our try to create a net of structures and also of doctors interested in improving the application will be something.
Would you prefer for the next talk a slide with first Hermitage in 1990, the second in 2001. Now there are 5, and projecting the hyperbolic curve to 100%.
Okay.
The project of medical hotel Hermitage, medical hotels Hermitage was born 15 years about 15 years ago. Was born? No, it's the project of the rehabilitation in the hotel.
Look at the internet, there are 2 options.
Okay.
Residence, yeah. Now there are 4 medical hotel in Abano Montegrotto, Continental Hotel and Gardens Hotel now, and La Residence and the Medical Hotel now 4. Yeah, but I think.
I have a question for Professor Maccarone, if it's possible. Hello, nice to see you. Thank you for the wonderful presentation. I'm curious, 2 things. One, I think it's very interesting, the concept of distinguishing different mineral water types, almost as a therapeutic compendium for different components, and maybe you can speak a little bit more about your work with that. But also, I think very interesting, the studies you're doing with long COVID remind us of the importance of convalescent care in post-infective cases and the role for rehabilitation medicine in the world of immunology and viral illness. So maybe you can speak to those 2 concepts, whatever, but thank you so much for the information.
Thank you,
Thank
Dr.
you.
Thank you, Marcus.
So,
good morning or good afternoon.
It's morning. Good morning and an afternoon to you all.
Okay, no, okay. Sì. Bye. Good morning. Marcus, ciao.
Ciao.
okay, so thank you for your questions that are really interesting. Sorry if I exit from the video, but also, yeah, okay. For the first question, what we are trying to do is to collect data from different spa facilities in Italy that have different kind of waters. And in particular, we consider the sulfurous, sulfites, salso-bromoiodic and bicarbonate waters. We compared the results of our patients, and what we have found is that with sulfurous water we have positive effects, but to a less extent when compared to all the other type of water. But obviously these results are still partial, since we have a different number of patients in the different spa facilities, and so maybe also other effects can have alterated these results. But we are really interested in investigating the different effects of mineral in our results. And so we plan to go on this field and to further investigate this aspect. For the second question, we are now evaluating patients with long COVID. And we have published something about the fact that we don't think that the transmission of the infection of COVID-19 has been facilitated by the water, since all the guidelines, the international guidelines says that water is not a means of transmission and don't facilitate this effect. And so for the acute phase, now we are evaluating in vitro the relationship between the cells and the virus, to understand if water can facilitate or reduce the potential of the virus to infect the cells. So I hope that also these results will be published in a short time. And for patients with long COVID outcomes, we are now taking some comprehensive protocols with both inhalations, exercise in water, exercise out of the water, but in the context of health resort setting. And all these strategies seems to demonstrate positive effects in these patients. So we are now collecting the follow-up evaluation after months from the treatment in the spa setting, and I hope that also the follow-up evaluation will confirm the preliminary results after the treatment.
Fantastic. I wish you all the best in this work. Thank you for sharing.
Okay, thank you very much. Thank you. See you.
I underline one point, only one point. The sulfurous water show from literature a major effects, anti-inflammatory effects, respect to salso-bromoiodic water or bicarbonate water. And salso-bromoiodic water is used for patients with arthritis, and sulfurous is used for treatment for inflammation, for knees or sore or other problem, respiratory problem, lung problem. Usually.
Thank you for the clarification.
Any questions? Okay. Oh.
Okay.
Congratulations.
So, thank you very much.
Maria Chiara. Brava. Bravissima.